This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll hear each extract once only. Remember, while you're listening, write your answers on the question paper. At the end of the test, you'll have 5 minutes to transfer your answers onto the separate answer sheet. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now turn over and look at the notes for extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase.
Anita, what has brought you to counselling?
So I've been in a relationship with somebody for about 6 months.
Okay.
I wanted us to move forward with our relationship and get married, and he's not on the same page as me, and it's causing a lot of tension. And then in addition to that, my mother's very unwell, so I have a lot of things to deal with at home with her as well. And then my boss is putting a lot of pressure on me to deliver everything on time, and so I'm just having some trouble juggling everything at the moment.
Yeah. And I can see that all of these combined are making you feel quite overwhelmed.
Oh, very. And it's just really, there are some times when I just come home and I have to deal with my mother, and I have to deal with my relationship, and then I have to go to work the next day, and I'm having trouble with that, and it just makes me really upset.
Okay, yeah. And I'm wondering, Anita, how long have you been dealing with all of these issues?
It's probably ramped up in the last 3 months, but I've been in my relationship for 6 months, and my mum's been sick for the last 3-4 months, so it's not that new, but it's now starting to get worse. So
yeah. So how have you been coping so far with all of these pressures?
Not very well, but yeah, I just take it day by day, and communication's a bit of a difficult one. Like I said, this is my first time doing counselling, and don't really have anyone else I can turn to, so it's very hard.
Yeah. I do understand that it is very hard to seek support in such personal issues, but that's what we're here for, and that's what we're hoping that we can do with this session as well. So given that this session's very different to the other ones, I just wanted to know, you told me that you are experiencing some concerns with your partner because you want to move forward and he's not in the same place as you, and your mother's quite sick, and you're looking after her as well, so that's an area of concern for you. And then you have some pressures with work. So I'm just wondering if we could prioritise any of those concerns. What would the biggest concern be?
Well, probably dealing with my mother and my relationship are probably quite equal, because my mother's also putting a lot of pressure on me to get married. Obviously she's not well, so she wants to see her family happy. Dealing with that situation is probably the number one thing for me at the moment, and the work thing I can deal with because I try not to bring work home, but obviously that's a bit hard too.
So when you say dealing with that concern, do you mean working the relationship with your mother or the relationship with your partner?
Probably with my partner first, because I feel like I'm putting a lot of pressure on him because of what's happening with my mother.
Okay. So what we can do is, if it's okay with you, focus on that area first, and we will look at all the areas that are overwhelming you, but we can start by working on that issue first, if that's okay. Yeah?
Yep.
Excellent. So we only have a couple more minutes before the session ends, and I was wondering if you had any other questions before we go and sign the contract.
No, just maybe in terms of the number of counselling sessions I'll need. I know you said that the first 6 are free, but obviously money is a bit of a factor as well. So what happens if I have to go over the 6 sessions?
Yeah, and I do apologise, I said when we'll go and sign the contract, but you already signed it. But so if you go over the 6 sessions, it will be $70 after for each session, and you can, like I said, you can continue as long as you need to. So it's really difficult to find a time for every single person and have a set time. So we like to see how it goes, and together we can work out what the best time frame is for yourself.
Okay.
Okay. Excellent. So if you don't have any other questions, we can book another timing next week for you.
Yeah, definitely. Thanks. Do I speak to reception about that?
Yeah, well, I'll come out with you and we can sort that out.
Great, thank you.
Okay, it was lovely meeting you,
Nice
and
meeting
thank you
you
so
too.
much for opening up and having that chat with me. And we'll focus on the first topic of you and your partner.
Okay, thank you.
Okay,
Thanks
excellent.
very much.
Thank you.
Extract 2. Questions 13 to 24. You hear a physician talking to a patient called Rasputin. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Extract 2. Good morning. Please take a seat. Tell me about your problem. Good morning, doctor. I currently work as a phlebotomist and respiratory therapist in a hospital. When I was attempting to do a blood gas, I had my left hand finger over the pulse and I was inserting the contaminated needle using my right hand. I was wearing protective clothing and gloves. As I advanced the contaminated needle, I jerked away, causing me to pull out of the arm and accidentally pricked of my index finger. I was seen and evaluated at the emergency ward immediately. In the diagnosis, I was found to be a carrier for hepatitis C and negative for HIV. I had a periodic screening, including blood tests. I completed a 3-shot series for hepatitis B and had titers drawn that shows protected antibodies. I am up to date on my immunization, including tetanus. What's your age? 36, doctor. What medications are you taking? Nexium. Any previous medical history or surgeries? I had degenerative disc disease in my back. Are you allergic to any medications? I am allergic to IV contrast. Are you continuing your work? Yes, doctor. Well, your temperature is 97.2 degrees, pulse rate is 84, respiration's 14 and unlabored, and blood pressure 102/70. You are negative for HIV. You have no other symptoms suggesting acute hepatitis. Your liver function test is normal at 18 and you have no signs of infection. You have developed acute intestinal illness due to blood-borne pathogen exposure secondary to contaminated needle stick. Continue with Nexium 20 milligrams a day until the condition improves. Otherwise, you are medically fit and no need for further diagnosis or treatment. Thank you, doctor.
This is the end of Part A. Now, look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete the answers as you listen to the audio. Now, look at the question 25. You hear a discussion between a doctor and nurse about different types of blood tests for leukemia. Now, read the question.
Hello, doctor. What are the different types of blood tests for leukemia?
Well, blood tests, such as complete blood count, can detect leukemia. A complete blood count determines the number of red blood cells, white blood cells, and platelets. Cytogenetics Analysis is a blood test in which a sample of blood is examined to check for changes in the chromosomes of the lymphocytes. Peripheral blood smear determines the presence of blast cells and shows the type and quantity of white blood cells. Other various blood tests may be ordered to see how organs are functioning and if they're being affected by leukemia. Question 26. You hear a discussion about different types of melanoma. Now, read the question. There are 4 major types of melanoma that have the potential for metastasis, with distinct characteristics. Lentigo maligna is often found on the head and neck region. Superficial spreading melanoma is more commonly found on the trunk, upper arms, and thighs, and is the most common form of melanoma in white races. Acrolentiginous melanoma is more commonly found on the hands, feet, and nail beds, which is similar to lentigo maligna and superficial spreading, in which it has a relatively long, flat phase before it penetrates into the deeper levels of the skin. Nodular melanoma can occur on any skin surface, but is found more commonly on the trunk, upper arms, and thighs. Question 27. You hear a discussion about lung cancer. Now, read the question.
Hello, doctor. What are the different types of lung cancer?
Squamous cell carcinoma, or epidermic carcinoma, usually starts in the bronchial tubes in the center of the lungs and can cause symptoms early on, especially hematypus. Large cell carcinoma often occurs in the outer regions of the lungs and tends to grow rapidly. Mesothelioma actually begins in the mesothelium, a membrane that surrounds the lungs. Small cell lung cancer usually grows in the central areas of the lungs, and most people have few symptoms until just before they are diagnosed. Lung carcinoid tumors are made up of cells called neuroendocrine cells. Question 28. You hear a discussion about non-inflamed comedones. Now read the question.
Hello, doctor. Can you please explain to me what are non-inflamed comedones?
With non-inflamed comedones, there will not be redness or swelling of the lesion. However, non-inflamed comedones may turn into a pimple when bacteria invade. Open comedones, or blackheads, is an accumulation of dead skin cells and sebaceous matter within the follicle. Soft closed comedones develop when a plug of cellulose debris and oil becomes trapped within the pore and are covered by a layer of dead skin cells. Hard closed comedone, called milia, have very obvious whiteheads, which is not pus, but rather a mass of dead cells and sebum. Microcomedones occur when the sebaceous duct in pore opening becomes blocked by excess sebum and dead skin cells. Every blemish begins as a microcomedone. Question 29. You hear a question about acnes. Now read the question.
Hello, doctor. Could you explain to me what are acnes?
Well, there are different types of acne which are not just classified by its severity. Acne vulgaris can appear on the face, back, shoulders, and buttocks. If you break out, most likely it is the acne vulgaris comedomal acne, appears as bumpiness, blackheads, which can occur anywhere on the face or body that can range from very mild to quite severe. Cystic acne is the most severe form of acne, which can occur anywhere on the face or body. Acne cysts occur deeper in the skin than the typical pimple, take weeks to heal, and can cause a lot of damage to the skin. Because they are so deep, topical acne treatments are not very effective. Instead, oral medications, like Accutane, are the best option. Nodule acne is another severe type of acne vulgaris. Acne rosacea is a type of acne that affects adults above 30 and occurs only on the face. Acne machantia is caused when there is excess heat, pressure, or friction on the skin. This type of acne is most common on the body, but can also occur on the face. Acne cosmetica is caused by products like creams, makeups, and moisturizers, and even certain hair care products cause this type of facial acne. People with excoriated acne chronically and excessively pick at pimples to the point of causing wounds. Question 30. You hear a discussion about athlete's foot. Now, read the question.
Hello, doctor. What are the different types of athlete's foot?
Athlete's foot is divided into three categories: chronic interdigital athlete's foot, chronic scaly athlete's foot, and acute vestibular athlete's foot. Chronic interdigital athlete's foot is characterized by scaling, maceration, and fissures, most commonly in the webbed spaces between the fourth and fifth toes. With this type of athlete's foot, itching is typically most intense when the socks and shoes are removed. Acute vesicular athlete's foot is the least common type of athlete's foot, caused by trichophyton mentagrophytes, that is characterized by the sudden onset of painful blisters on the sole or top of the foot. This type of athlete's foot is also caused by jungle rot, a historically disabling problem for servicemen fighting in warm, humid conditions. Chronic scaly athlete's foot is caused by trichophyton rubrum. This dermatophyte causes dry, scaly skin on the sole of the foot. The hands may also be infected, although the usual pattern of infection is 2 feet and 1 hand, or 1 foot and 2 hands, and these are most commonly seen in patients with eczema or asthma.
That is the end of Part B. Now look at Part C.
Part C, questions 31 to 42. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Now look at Extract 1. Extract 1, questions 31 to 36. You hear an interview with Dr. Christine Erickson, who's talking about her research supporting non-fasting lipid blood tests for cholesterol. You now have 90 seconds to read questions 31 to 36. Hello and welcome to Health Research Roundup. For decades, people have been asked to fast before they have blood tests to check cholesterol levels. However, a new research report from an international group of experts suggests that this is not necessary. To discuss this research, my guest today is Christine Erickson from Copenhagen University Hospital, who was a lead author of the study. Christine, welcome.
Thank you very much.
So why did we ever ask people to fast for blood lipids, for your blood fats?
Well, if you ask me, I don't really know, except for that's what we've been doing for so many years. I really tried to read the literature and find some very scientific evidence supporting that it is superior to just taking a random non-fasting blood sample as we do now. And I had problems finding the evidence. There's a lot of arguments people put forward for why you should use fasting versus non-fasting, but really solid evidence that is better, I can't find it.
So was this a tradition rather than science?
I think so, yes. I mean, you can ask me why did it start? I think that some of the early studies, the original publications way back, said that they used fasting samples and therefore everybody thought you had to do that without really thinking why. But those early researchers may have had good reason to do it that way, but there's nothing I've seen that said it had to be done that way. And there's all this evidence now from Canada and the US, 2 excellent studies, one in children and one in adults. And then we have a lot of studies from Copenhagen, and they all show that when you just look at people that eat and drink whatever they usually do, and you take a lipid panel, cholesterol, triglycerides, a very common fat in the blood, then they don't really change very much in response to when you have been eating.
So there is a difference?
Yeah, the difference is in millimoles per litre. So it goes up by about 0.3 millimoles per litre. However, in clinical practice, when you look at triglycerides, you're interested in whether it increases 1 or 2 millimoles, not 0.3 millimoles. So that's what's clinically relevant.
And even with a bad form of cholesterol, that's not going to make the difference between whether or not they put you on medication?
Yeah, that's right. We provide data in this report where we did direct measurement and after fasting and in about 6,000 people, and the correlation between the two methods was, I can't see the difference. It looks exactly the same.
So you moved over in Denmark to this official recommendation about 7 years ago. So what's happened since then? Have there been any issues because of undiagnosed cholesterol levels?
No, everybody was happy right away. Even the laboratories that didn't change right away, they were pushed by patients because there were reports in the media telling them that at Copenhagen University Hospital we're doing non-fasting, so everyone wanted to do it. And I can say today, patients, clinicians, laboratories, everyone's happy. Everyone likes it because it's so much simpler.
And patients like it because they can go when it suits them to the pathologist, so they're more likely to turn up for their blood tests?
Yes, of course. I don't have fantastic good numbers for you, but certainly you hear from so many colleagues that people don't go to have their lipid test because it's so complicated to fast. And then they have to go to work to have an important meeting, and they can't do this in the morning. But now, doing a random non-fasting, you can come whenever it suits you.
And very briefly, is there any circumstance where you should have a fasting blood fat level done?
Well, this recommendation, it's 21 world experts, many from Europe, the US, and one from Australia also. And of course, when you have so many experts, there's always someone that thinks there's certain situations. We list a few where you can do. For example, for patients with diabetes, the fasting requirements might be an important safety issue because of problems with hypoglycemia. But if you ask me, way down in my heart, is it necessary? I don't really think so.
You hear a physician called Dr. Hubert Johnson discuss improving efficiency at a healthcare practice. You now have 90 seconds to read questions 37 to 42.
Hi everyone, my name's Dr. Hubert Johnson, and I've been asked to speak to you about my experiences in the healthcare industry concerning something that affects all health professionals, improving efficiency. It seems to be a given these days that practices will struggle with a lack of efficiency. We've actually found that this expectation in and of itself can reduce efficiency and increase delays even further. In a recent survey, when patients were asked why they arrived late to their appointments, 30% said that they had assumed that the previous appointment would run long. Patients expect to be kept waiting, and to some extent, we expect that patients will be kept waiting. And so the first thing we need to address is our attitudes and the attitudes of our patients. So let me start by telling you about the efficiency I observed in a practice I visited a couple of weeks ago. At this practice, patients could not make appointments online, but they could either phone up or make an appointment in person. There were never more than 2 receptionists working in the morning, and the practice generally scheduled 80 appointments each day. Patients who were not attending a follow-up appointment were required to make their appointment on the day of. Can you imagine what that practice was like in the first couple of hours they were open? The receptionists were inundated by calls and walk-ins trying to schedule appointments. As you can imagine, Patients who had seen what the practice was like in the morning expected that if they didn't have the first slot of the day, they'd be delayed by at least 10 minutes. So naturally, they arrived to their appointment 10 minutes late. One of the most important things you really must address in your practice in order to improve efficiency is the way you present your practice to patients. If they believe that you are always running late, guess what? They'll be running late too. Now, let's think for a moment about what needs to be done on the patient's end before an appointment can take place. You might be thinking that there are only 2 steps to the process. 1, the patient books an appointment, and 2, the patient arrives at the practice in time for their appointment. Well, we healthcare professionals often forget that there's actually a step that comes before this. Firstly, the patient must decide that their issue is significant enough to warrant an appointment. So, about a decade ago, my practice was really struggling from a lack of efficiency. I was working extremely long hours to try to accommodate everyone, and I was becoming increasingly frustrated with conducting appointments that didn't seem strictly necessary. I got to thinking about how I might be able to help patients to reconsider their initial assumption when booking appointments and to treat minor issues at home. At the same time, I did not want my patients to feel unsupported. I decided that I would begin to give weekly presentations in the evenings about self-care. As I tended to see a multitude of patients coming in for similar issues that they could actually treat themselves, each week I focused on a different common theme. The presentations lasted for just 1 hour, but I found that they resulted in 7 fewer unnecessary appointments each week. These days, of course, I no longer have to give a physical presentation. Thanks to modern technology, I simply upload instructional videos to our practice's website. We also email these videos out to patients periodically. We can and should make use of technology as a tool in our practices to help us improve efficiency. However, it's important to note that while many, perhaps even the majority of your patients will be capable of using technology to arrange their appointments, there are many people uncomfortable or unable to use technology, so you must always make sure that these patients are accommodated too. Providing your patients with more options rather than replacing old options is often the best practice for improving efficiency. Now, let's move on to look at a practice that used technology in a surprising way.